One day, Miss Huang went to a clinic for help. The doctor checked Miss Huang's basic condition with a cotton swab and casually discarded her mask and cotton swab. The nurse was irresponsible and casually threw away needles and cotton swabs. As a result, the cleaning staff was stabbed by needles while cleaning. The first part is classification method of infectious clinical waste. For risky level, classified based on the potential risk of infection they pose. High-risk waste includes sharps and pathological waste, while lower-risk waste might include contaminated PPE. Secondly, classified by the source of generation, such as laboratory waste. Besides, classified by the type of treatment required, for safe disposal, such as incineration. The next part is classification of infectious clinical waste. Sharp waste includes used sharps like needles, and requires special biohazardous waste handling for safety. Dangers of sharps waste involve the spread of bloodborne pathogens like HIV, affecting both healthcare professionals and the general public. Pathological waste includes organs, tissues, surgical specimens, and bodily fluids, but excludes teeth. Pathological waste may contain potential contaminants like toxins and infectious agents, as identified by the CDC. Microbiological waste includes cultures, specimens, sharps, contaminated tissues, body fluids, and pathological waste, as well as disposable materials and used PPE. We need to protect healthcare, scientific, patients, and the general public from exposure to infectious and potentially dangerous contaminants. Contaminated PPE can carry infectious agents, posing a risk of disease transmission or pose risks to waste management personnel if not handled correctly. Isolation waste includes waste from humans and animals with highly communicable diseases. If isolated waste is mismanaged, the risk of spreading infectious diseases is high, especially in the case of diseases that are easily transmitted through contact, droplets, or airborne routes. The next part is disinfection technologies. Here introduces 5 kinds of disinfection method. First, steam sterilization is a high-temperature process using steam under pressure to eliminate microorganisms. It's high efficiency and environmentally friendly, but consumes lots of energy, relatively expensive. Secondly, microwave disinfection utilizes vibration and heating to above 100 degrees centigrade for rapid disinfection. It is efficient and energy-saving, but requires high standards. Third, chemical disinfection using like chlorine compounds and so on to kill pathogens. It's easy to operate, but it may produce harmful chemical residues. Fourthly, plasma treatment is a plasma state that utilizes high-energy electrons, ions, and free radical to kill microorganisms. It is efficient and environmentally friendly, but it comes at a high cost. The last one is radiation disinfection. It uses gamma rays or electron beams to kill microorganisms. But it is also very expensive and requires high standards. The following is the subsequent treatment process of infectious medical waste. After disinfection, Sharp waste can be mechanically crushed or broken down to reduce its volume and eliminate sharpness, making it safer for further handling and disposal. Then, crushed waste can be incinerated or disposed in landfills. In the end, we should think about waste gas and liquid treatment and record management and monitoring. So after learning, we went back to the original clinic together. Miss Huang returned to the clinic again, where garbage sorting has been carried out, including medical waste bins. The doctor also reminded the patient to wear a mask properly. Recyclable medical devices, such as thermometers, have also been disinfected. Disinfection is required before and after use. Daily garbage should still be thrown into the general waste bin. The nurse was responsible for wearing disposable medical gloves. There are medical waste bins and sharks waste bins here. It can be seen from this that the classification of medical waste at the source is very necessary. So, let's take a look at the current situation of medical waste in a country.